Okay. Hey everyone, it's me, Christina. Today has been a very, very busy day. I made some chicken carbonara. God, you guys. I have spinal stenosis and my back is killing me today, and it's got me in a funk. Like, I am in a funky mood because of it. Kind of just like, out my face, everyone. Ain't feeling it. And the system is so messed up here. There's so many people that are like hooked on crazy medications, or they try to take illegal drugs on the street. So, like, it's like they're trying to make this huge law that they can't like really prescribe like the effective painkillers, even if you have even many different diagnoses that require it. I know it sounds crazy. Like, if you are like require it, why wouldn't you be giving medication? You know what I'm saying? Because there's all these punk like teenagers and old rich housewives sitting here buying drugs and like freaking abusing their prescription medication. So when someone really needs something, you're screwed over. Like, they will only give it to you if you're in the emergency room or you're like fresh out of surgery. But if you have any chronic illnesses, they're like, sorry, you have to really, we only really suggest you get an injection in your back. And like, that is so not cool, because like, they even said, like, every time you get the injection in your back, you're basically risking paralysis. And if anyone has ever had, like, a spinal or an epidural done, they know that it is a very painful procedure to have done. And especially if you already have different back disorders. And to go through that kind of risk every single week is really ridiculous. Like, who the heck? Like, that should be like illegal, like medically illegal, to actually force patients with a real diagnosis of issues to go through a very traumatic and dangerous procedure every single week to manage their pain. Like, does anyone else see something wrong with that picture? Like, holy crap. You know, I'm bored with this setting. Let me go here. Darn it. I'm gonna do that later. Anyway, so, yeah, you guys, that is the situation up in here. It's actually really a shame, like, that many people out here abuse medication and like, I heard someone said that they took their medication and they freaking sold it on the street. You hear this, you guys? They sold the medication on the street for some crazy like street drug. They just exchanged their medication for some whack crap on the street. Like, who does that? Like, seriously, who the heck does that? And that makes me really wonder, like, were these doctors giving medication to people who had, like, little things like a slight headache? You know what I'm saying? Something that Advil, Tylenol could have managed? Like, this is getting out of control here. It is like really crazy. So I'm kind of really disgusted about that, because then you got people who have real issues and they're screwed over. Like, someone very close to me, a relative where we used to live, could get their medication, and the doctors were saying, yeah, with your illnesses, you definitely qualify for this kind of pain management, but we are like not legally allowed to give it out here anymore. And then another doctor said, well, you know, the problem is also that so many doctors are getting paid now and getting other incentives from the insurance company and pharmaceutical companies to give the injections. Mm-hmm. Like, what the heck is that? Like, seriously. So, I mean, if you're somebody...
Okay, I'm gonna get a plate.
If you're somebody who wants the injections and wants to try that method, that should be fine. If you are okay with the risks, the feeling, the whole, process. But if you are not comfortable with it as a patient, and there are several different modes of treatment that you qualify for, you should not be forced to take a medication and undergo a procedure that you really do not have to and really, aren't comfortable with. Like, it's really outlandish. So that was really upsetting for me because this person was very ill and extremely close to me in my life. And I knew the kind of pain that they dealt with daily, in that their pain was not sufficiently, 100%, it wasn't gone 100%, but at least it, the medication made it manageable for them and more comfortable for them to do their hobbies, to, just function in life, whether it be where they had to go shopping, get to their doctor's appointments, do whatever they needed to do. They at least got brought to a level of comfortability where they could perform just daily, regular crap. You know what I'm saying? So, this is like something that hits really close to home for me. As well as because they will most likely want to give me back injections for my own issues, and that terrifies me because, one, I have spinal stenosis and some other back issues, and it's very horrific for me because I know anytime I've had shots in my back before, it is a scary process. It hurts. And my condition has gotten worse. So I am not very comfortable with this. Like, it freaks me out. Not to mention, I would have to drive like almost a half hour every week, which together to get there and back, I'd have to drive an hour somewhere every week just to get medication when I could have it in the comfort of my own home and just easily take my medication. Like, most people take their medications in pill form unless they have like diabetes or something that requires insulin, or not insulin, I'm sorry, something that requires like a shot or something. So, or vapor, like when you got like asthma or something. But you know what I'm saying? It's like so ridiculous to me, and I don't know, I just feel like people really underestimate what happens in life when simple things like you can't get the proper treatment and medication just to go on and do what you need to do day to day. And I know, as a sufferer from chronic pain, when you're in a lot of pain every day, a lot of physical pain, it really like drains you. You feel exhausted. You feel like you just don't want to do much of anything, or you feel like, oh my god, I gotta get everything done bright and early when I wake up before the pain gets even more intense. Because you know how, like, just like with sickness, when you get sicker, you usually feel worse in the, night or later hours of the day when your body starts to dwindle down and get more worn out. So it's the same thing, with pain. As the day goes on, you will feel like you're in more pain, in that you just feel like crap, literally. So, I don't know, you guys. I'm kind of really upset by this because I feel like something needs to be done. Of course, if you do not qualify for a certain kind of treatment, no, you should not be getting it. But people who do qualify should not be forced to get a treatment that they, one, are not comfortable with, or two, just don't want to take. You know what I'm saying? You should not be forced to receive a certain kind of treatment when technically you qualify for many different modes and different kind of medications that you could try. You know, if you feel like, you know, injections are the way to go, great, fabulous, that's great for you. But for those of us who don't feel like that's the way they want to approach their treatment plan, they should not be forced to do it. Especially when they could do it in many other different ways. So, that's my little rant on this and the drug problem apparently in North Jersey. Disgusting. Need to get it together, people. Come on. Really? And especially in this part of Jersey where it seems like most people they're either punked out teenagers or young college students or lonely old rich housewives and men who go on business trips and just decide, you know what? Yeah, I had a surgery 10 years ago and I like the feeling of that medication. Let me try to get it on the streets. Or let me try to fake an injury, and then, try to, make it seem like I got issues so I can constantly get crap. Like, that is crazy. So, yeah. That's my little rant right now. Feel free to comment down below. Whether or not you have the same opinion as me, I don't care. I would be excited to hear your input and your thoughts on this. I will probably be posting another video, but I just had to get some stuff off my chest right away. Bye, guys!